So in this video I will be discussing the basics of the interferon alpha Itaconate shunt hypothesis and briefly describing what it is. The Itaconate shunt is Dr. Rob Fair's and Dr. Ron Davis's new hypothesis of a possible cause for ME/CFS. The Itaconate pathway is part of the innate immune system that is triggered by an infection. It occurs in the mitochondria of certain cells, which are responsible for providing these cells with energy. This is done to reduce the amount of energy being provided to the cell to starve the infection of energy. It does this by interrupting Krebs cycle, which is a series of chemical reactions that produce high energy molecules called ATP that give the cells energy. Normally this would cause you to be tired and rest when you are sick. Their hypothesis is that this Itaconate pathway never turns off in people with ME/CFS. They believe that this would likely only be in some cells of the body. Cognitive symptoms. This hypothesis would also explain why previous studies have found that we cannot burn glucose or fats for energy well, but can burn amino acids. They suggest that if this is happening in the brain, then our body may be burning certain neurotransmitters that are amino acids for energy. This could explain the cognitive symptoms experienced in ME/CFS. Interferon alpha. They believe that if this hypothesis is true, that it should cause higher levels of a protein called interferon alpha to be produced by the cells. This might be measurable by measuring the level of it found in ME/CFS patients' blood compared to healthy controls. They have done this and found that the average amount found in healthy controls is 4 times lower than the average in ME/CFS patients, but there were outliers in the healthy controls. They are now measuring the levels of interferon alpha in the cells to see if there is a high enough amount to be causing a feedback loop. Treatments. They predict that if levels are high enough in the cells, that the interferon alpha levels could be causing the cells to stay in the Itaconate pathway and become stuck, even when the cells are no longer fighting infection. They are looking at a group of drugs called JAK-STAT inhibitors for any drugs which may be able to stop this feedback loop from occurring.